justorthopedic.com, and I am sitting with Dr. Charles Whittenburg with Orthopedic Center of Arlington. Are you doing okay today?
Yes, thank you.
Great. Well, after reading your profile, I found it pretty interesting, some of your stories that I read. Can you tell us why it was your lifelong dream to become a physician?
Sure. I mean, I was thinking about being a physician from a pretty young age. I can remember, talking with my dad about it, and he encouraged me. I guess he saw that I had some interest in science, and as a kid I was always looking at science books and things like that. So I would say from probably age 5, 6 years old, he was taking me to the library, and I was getting, books on, human anatomy and stuff like that. So it was a really early interest of mine, and my parents both actively encouraged it. So it was just, I basically don't remember a time in life when I didn't want to be a physician. So for me, it was very early.
Well, why would a parent not want their child to become a doctor, right? It's perfect. But I do know that you actually have a personal story that really led you to become an orthopedic surgeon specifically,
right.
And specializing in total joint replacement. Can you tell us about that?
Well, basically when you're in medical school, being in medical school is kind of like, being in college and not declaring a major yet. You're taking all these general courses about science and embryology and biochemistry and all these things, and so you have this pressure to at some point pick something. And for me, it was in my first year of medical school with my it so happened, again, my dad, he was dealing with an orthopedic problem at the time. He had a pretty bad degenerative hip, and he was only in his mid-40s. And the problem with this was, it wasn't just a physical limitation, it was also a mental limitation in his professional life. He was younger than I am now, and he's limping around at the office, and his bosses and things are asking him, what's wrong with you? And it made him feel like an old man before his time. And so it didn't, not only did it limit him physically, it limited him mentally. And he ultimately went and had a hip replacement, and it literally changed his whole life. He got better from the pain from the hip, of course, but in another way, he gained his self-confidence back. He didn't feel like he was old before his time. He was able to walk around like a normal person and not have everybody in town asking him what was wrong, why was he walking that way. So I thought, that's pretty cool. And I thought, that's what I want to do. And so it was just like that. I mean, as soon as I kind of made that decision, I dedicated everything I had in medical school along those lines, trying to get into an orthopedic residency.
I love that inspired you, and I think as a patient, it would, to have you as their physician, it would be great knowing that you had that personal investment there. So what a wonderful story.
Yeah, my father was a big influence on my life, and he still is today. So
that's fantastic. That's great. Well, let's kind of get down into the nitty gritty, and
okay.
I know you do a lot of total knee replacements. Can you tell us exactly who a candidate is for that?
Well, total knee replacement is something that's done at the end of a problem known as osteoarthritis. Okay, inside of the knee, lining the bones, there's cartilage on the ends of the bones, and that cartilage prevents those bones from rubbing together when we're standing and walking. Over the years, the cartilage wears down, and progressively, as this goes on, bone begins to be exposed inside the knee. And people notice that not only does the knee hurt, you can actually hear it crunching and grinding, so to speak. And along with that comes inflammation and pain. So that problem just gets worse and worse with age and with use and abuse. And we're seeing it a lot more in people that are in their 40s now. It's not just a disease of 60s and 70s anymore. We're seeing more and more folks in their 40s having this problem. And so when this comes to a head is when the conservative treatments are no longer working. We start off with anti-inflammatories and knee injections and more conservative treatments like knee arthroscopy, but As time progresses, those become less and less effective, and then we ultimately wind up doing a knee replacement. A knee replacement it sounds like we're taking out the entire knee and replacing the knee, from mid-thigh to mid-leg, but that's not really what it is. What it really entails is opening up the knee and resurfacing the ends of the bones so that we don't have those rough surfaces rubbing together any longer, okay? So that we have a bearing inside the joint so that the bones aren't scraping together every time you move your knee and every time you walk and stand. So it's more of a resurfacing of the ends of the bones than it is a complete replacement of the entire knee joint. A total knee replacement means that we're doing both sides. A partial knee replacement means that we're only doing one side, and that's typically the medial side of the knee.
Well, it sounds like that, prior to surgery, it's pretty debilitating, but with these procedures that you have in place now and that you're doing every day, certainly helps people and changes their lives.
Absolutely, and the rewarding thing about it for me is that we're usually dealing with patients that are relatively healthy, except for this problem that really limits their functionality. And along with that limited functionality comes a limitation in your mental functioning as well, and your self-esteem. So one of the rewarding things about it is the return of self-esteem along with the functionality.
That's wonderful. Well, again, this is Dr. Charles Whittenburg with Orthopedic Center of Arlington. I'm Elisa with justorthopedic.com, and don't forget, please take a look at Facebook, LinkedIn, and Twitter.